Hey everybody. Good evening. Are you guys off work and Zooms yet? Hey Tim. Hello, hello. Oh, you guys are out here. Is it raining where y'all are? Hey Tim. It just threw down out here. And then I come from up under my work rock just to find out there's a hurricane, a whole hurricane. So Hampton Roads, need you to understand that we are watching the system. But you might want to, pick up some stuff with your mask and your social distancing or get an Instacart delivery. But maybe keep a look on that and maybe come up for air from work every now and then so you know if there's a hurricane coming. Oops. But there she is. Courtney is in the room and she's going to press the button. Yep, she is. And I'm going to say, hey there.
Hey,
How are you?
I'm well. How are you? Happy Friday.
Yes, happy Friday to all. And we are so excited. We have a few people that have already joined us. We have let everyone know that there is, in fact, a hurricane that I
Yes,
just missed because of the Zooms. So we are going to get ourselves prepared
yes.
and make sure that I know that my next thing is I'm going to call the mayor after here to make sure who is doing what. But I want to thank you for joining me this
Absolutely.
Friday evening, this last day of the Maternal Health Awareness Month. The
Yes,
first ever in Virginia because of House Joint
yes.
Resolution 111.
All
But
thanks to you. Thank you so much.
it was a group effort. So we were working with a local roundtable. And that was one of the ways that we could bring awareness to some of the situation that pregnant people were experiencing here in
Yes,
Virginia. Um, I personally started hearing things when Beyonce was talking about her experience, and Serena Williams was talking about hers, and Judge Glenda Hatchett's daughter-in-law, who
yes.
unfortunately didn't make it.
So
And
tragic.
then I had family members that were like, "Oh yeah, me too. You didn't know?" I'm like, "No, I didn't know. I wasn't in the room."
Yes,
So there were these lives and these people that I love and respect and just would not have thought that the doctor wouldn't listen to them. And then you start hearing even more
yes,
around the state. So we are here to talk about maternal health
yes.
and the role that doulas play. And so I want you to introduce yourself, Courtney. And then the first question I have is, what is a doula? What do you do?
Okay. So, hey, everybody. My name is Courtney Glenn. I am a doula in and around Central Virginia. I am half of the Remedy Birth Services team. I do believe my business partner, my co-doula, Keandre, is on the live. Hey, girl. Um, but yeah, so I am a doula. This is my 11th year supporting pregnant people, families, and communities. And basically, so I'm a doula. That's the common name known for it. I like to say that I am a pregnancy support practitioner
Okay.
because a lot of people associate doula work with being with you when you're in labor, helping you,
Hmm.
changing your body in position, supporting you through the labor process. But I have found over 11 years that doula work is throughout the pregnancy, before you're pregnant, in the postpartum period. I go to first birthday parties, I get first day of school pictures. It's really a lifelong thing. I am so privileged to support people during such a vulnerable period of their lives. But yeah,
Yeah.
overall, doulas provide emotional, mental, and physical while you're in labor support
Okay.
to pregnant people.
Awesome. Yeah, I think my introduction to it was through television and movies, and it was always like right at the moment
Mm-hmm.
where the baby is coming and they're there in the room for support. So that sounds really important in that moment. But I also know that some of the work that you all do might be with doctor's appointments as well. So if you're like if somebody's pregnant and they're about to go to a doctor's office, they might be nervous. They might not know what's going on. They might not have information, so they're intimidated. What might the presence of a doula help when it comes to, other practitioner and patient interactions as well?
So I like to remind people that doulas are part of the team. We are not providers, so I am not a midwife yet or an obstetrician,
Okay.
or an MFM. But what we do is work as part of your team. So you may have questions going to your doctor's appointments, and typically those appointments can be quick. Like you might have 15 minutes with your provider, and in the moment when they say you have any questions, you might be like, oh my gosh, I forgot everything. Pregnancy
Mind
brain.
blanks, right?
Yes. Yes. So what we like to do is we actually, when we meet clients, we give them a journal and we say, jot your thoughts, jot down any questions you might have through the week, whatever you're feeling, you can check in with us, but write them down so that when you go to the doctor, you don't have to think about what your questions are. You've had 2 weeks or 4 weeks or 1 week, depending on which point you're at in your pregnancy, to think about what your body is doing, how you're feeling, and what
Hmm.
questions you want to get answered by your trusted provider.
And so I know one of the things that I've heard, and just from some patients when they're in there, they've expressed themselves as something isn't right. And then they're told it'll be fine. And, so is that another part where you might come into the conversation? Advocacy, maybe?
Yes, so absolutely. So that is more common than we think. A lot of people like to say that some providers have white coat syndrome, meaning I'm the doctor, I know it
Yeah.
all. But I like to tell clients, you live in your body every day. You know your
Every
body
day.
better than anyone else. So if something feels off, if your baby's not moving like they typically do, if anything is weird, raise all the alarms. And even when you're not heard, it's nice to have a doula saying, you're correct. This is not typical for you, or this is not what you've been experiencing. Let's go back to your provider, or let's call the
Yeah.
nurse line. Let's make a lot of noise to get you heard. And if that doctor or that midwife is not listening to you, we're going to go to another provider, or we're going to check in at
Right.
the ER, or we're going to make sure. There is never too much caution that you can take during pregnancy. So
Absolutely.
yeah, so I think doulas in that case, it's advocacy on behalf of the patient, but they're advocating for themselves, and we are just there to empower and affirm them. You know
Got it.
what's going on with you, and we are going to help you get heard and get this issue resolved.
So, is there anything else that you can think of that you want people to know about doulas? As this may be a new term for some, there might be some folks that, just this is not my life. This is not my experience. So it was great to learn about these things. But are there any myths or misconceptions or anything that you want to clear up and just get it out there?
Yeah, so I think a lot of times when I hear people talk about doulas, they'll say something like, oh, well, I thought that was just for like unassisted birth, or I'm going to have my baby at home, I don't go to the doctor, or that doulas are crunchy or granola or whatever term people want to use. But so many of us are out there. There's a doula for everyone if you want one. You can find somebody who matches your personality, you like their energy, and you all work well together. So don't feel limited in your idea of what a doula is and does. Doulas are certified in many cases. We take trainings. We are constantly educating ourselves on pregnancy, postpartum, and the perinatal experience overall. So any good doula is going to be knowledgeable and know when they need to say, hey, let's check in with a provider, or let me get
Okay.
an answer for you. I think that it's also important that people know that doulas do a lot of education. I just want to run down. I made a quick cheat sheet. So
Yeah.
studies show that doulas often cut back on the time that someone is in labor. So our work shortens the length of your labor, can reduce a mom's anxiety, lower the rate of medical intervention. So births that have a doula present have lower C-section rates, lower
Ooh.
epidural rates, all the other interventions that are done typically in hospital settings, and improve mother-baby bonding post-birth. Like, that's my
Aw.
favorite part. When that baby's on your chest and it's time for the golden hour, I am backing everybody else away. Let this person meet their baby. They've been living together for 40 plus weeks. Let them get
Right.
to know each other.
Oh,
So
that's so cute.
yeah, so that is kind of, those are the benefits to having a doula. So it's not just this kind of like alternative thing that people do. There is evidence that shows that doulas benefit pregnancy, birth, and postpartum experiences.
That's awesome. Cause like I'm thinking and just life is already so much. And then you add like a pregnancy on top of that.
Yes.
Is it fair to say that, with some check-ins, you might be able to also push someone to get some mental health help if it's needed, if things are starting to get to be too much, maybe that they can, maybe have a friendly nudge that they
Yes.
might want to check in with somebody.
So perinatal mental health is something that is so important, and people often, don't know necessarily the signs. People just think, oh, you're pregnant, you're emotional. But
Right.
having that more consistent, constant contact with your birth support person, your doula, can allow you to know, like, hey, I'm feeling this way. And your doula might say, hey, well, maybe let's check in with an LPC or a therapist, or reach out to a pregnancy support group. A lot of practices are starting centering pregnancy, which is a group setting. So you're with other women who are on the pregnancy journey around the same due dates as you. So you all can share and kind of create
Oh,
community and be uplifted together. So yeah, I definitely think doulas add to the mental health toolkit during pregnancy.
that's awesome. Because I'm just thinking, like, if you feel alone and you think something weird is happening,
Yeah.
having that, just support of knowing, no, it's not weird. It does happen. Or, yeah, girl, that is kind of weird. You might want to get that checked out. Whatever it is,
Right.
just having that support and conversation. Okay. Well, I do know that this past session, doulas came up and Delegate Aird and I were working together on some things.
Yes.
And one of the things that I wanted to make sure is that I think people get better service when the provider, practitioner, whoever that professional is, gets paid
Yes.
well for what they do. And
Yes.
so there's this national conversation, and shout out to Congresswoman Lauren Underwood, who kind of
Right.
started some things at the federal level, and a delegate Erin and I were like, yeah, let's do that at the state level too. So can you talk about some of the things that you're happy are happening within the state, government, and then maybe some things that you can do to push my colleagues and I to do even better?
I will say that I am ecstatic that the conversation has started in the Commonwealth. Thank you to you and Delegate Aird. I know who have had some conversations with you all, have just been so uh, willing to advocate for the role of doulas and the importance that we have in perinatal health. And that's not something that every state legislature is willing to talk about or address. I think it's great that the conversation is even, happening. So like we got to committee now. So all right, next year, like we're making progress. And that is the benefit of having legislators who believe in the work that we're doing, know what's going on the ground, and are willing to have conversations with their constituents about things that are important to them. I will say, so like you mentioned, doulas are not widely covered by insurance or state-sponsored health care throughout the United States. The United States has the highest maternal and infant mortality rate among developed nations, meaning
Right.
that infants under age 1 and pregnant people die more in the United States than any other developed nation. So it's so important knowing those statistics I just cited about how how doulas, benefit pregnancy, having us present, having us accessible to people who are
Right.
either at risk or knowing that your insurance will cover it. Because think about it. If you are having a baby and you're thinking about, okay, we're going to have to pay for daycare after this, formula costs might be high. We've got, babies they can be expensive.
Expensive.
Yes. So, to think about on top of that, now I have to pay out of pocket for something that really is beneficial to the medical experience that I'm having. It doesn't make much sense. So
Right.
I think having doulas become covered by insurance plans and state legislatures considering the role of doulas in the perinatal health experience, because that's the experience that most people are having throughout their lifetime,
Yeah.
right? Like that's something that by and large, the majority of constituents are going to experience, whether they're having a
Right.
baby, their child is, their spouse is. We know that pregnancy affects nearly everybody. So
Right.
to have something like a doula, a support system, a professional who's educated, included and not have to be an out-of-pocket expense that makes you
Right.
decide, do I want to do something that's important to my family, or do I want to, you know, purchase the services of someone who's going to benefit me over almost the course of a year? People shouldn't
Right.
have to make that decision. That should be a covered expense, a covered service in healthcare. So making
Yeah.
that happen is going to drastically change so many things for pregnancy and birth in the United States.
And I think what kind of made it real for us was when we saw the data of what pregnant people in Virginia, the rates of maternal health right here in Virginia, and we're thinking like, oh yeah, we're the best place for businesses. We have like all this money. So why are people dying? Like just
Right.
doing something that's a regular part of people's life, should they choose to do that?
Yep.
And then we were like, oh, Aaron and I just kind of looked at a hotspot map
Yep.
and it was like Petersburg, Hampton Roads. And I
Yes.
was like, oh, and it wasn't that, we didn't care before, but that's why we really got to it because the 63rd district, the 95th district, parts across the water in Hampton Roads as well. It's like African American women can be up to like 2.5 to 3 times more likely to die between getting pregnant and a year after delivery.
Yes. That's the Virginia statistic. In the United States, is 3 to 4 times when you like do the conglomeration of the numbers.
Yeah,
So we are majorly affected. Black
yeah.
women are we have the highest maternal mortality rate in the United States, and that's why
And
so
let's
many of us have come to the work.
and I'm not going to forget my Latinx sister. It's like I mean
Yes,
my Latinx
yes,
sibling
yes,
because like they were up there on the chart
yes.
too. And
They
you think
are.
about access to care, access to
Yes,
prenatal care, all of that, and how it all plays together. Access to mental
mistrust
health
of
resources.
the medical
And
system. All of that kind of plays into why we are experiencing maternal mortality at the rates that we are.
one of the other parts too, in thinking about we had done work. We still have to fight because we're not sure what the budget's going to look like going into special session. But there was the conversation about, Medicaid paying for longer for the
Yes,
pregnant person after
yes,
delivery.
yes.
And I'm looking around reading some stuff and hearing conversations, and literally these conversations were as if the value of that adult stopped once they delivered the baby. And I'm like, no, they're a whole person.
Right,
They might have whole person issues before pregnancy,
right.
after. So you're thinking about if you're diabetic or have high blood pressure, or just these things that people have or disproportionately Black people have that could impact the quality of, or I should say quality, but could impact your pregnancy. So tell me more about that. Like, how can you guys be helpful within that realm?
Related to, I'm sorry.
Like, so if I'm going through something and I know that there is need for more coverage, can doulas, I'm going to lead you in the question now, can
Yes,
doulas come together and advocate for more coverage
yes,
to people like me so that we
yes.
fight for it as a priority?
Yeah. So that's one of the things I think. So I will just before preface this with birth is my first love, policy is my second.
Okay.
And so that's one of the things that I've done some work on. I know there are some other local advocacy organizations that are working really hard to bring doulas together, because the difference between, I would say, doulas and maybe your OB or your midwife is that we don't work within a practice. We are all self-employed for the most part, or working within an agency format. So everybody doesn't, there's no, you can be trained by different organizations, you can work in different places. So there are tons of doulas out there, but bringing us all together to talk about the challenges that we're facing and to build an organization that says, hey, we need to lobby for these things is so important. And I think the education not only starts with the doulas doing the work, but communities saying, hey, like you said at the beginning, my family member has experienced an issue during pregnancy or birth, or, this happened to me. I do credit Beyonce and Serena Williams with really building the conversation for us.
Right.
But I do think, doulas coming together and saying, hey, let's talk about, building something where we
Yeah.
can say to legislators, we are a credible group of professionals. Here are the issues that we believe are affecting quality of life, or the Commonwealth as a whole. How do we work on them? Let's work together. So right now,
Right.
I really think last year in particular, and the pandemic has kind of thrown it off, but we're in the stages of building together as doulas, creating these networks and these organizations to come to you all and say, hey, here are the issues, so that you don't have to do so much digging, and you all can say,
Right.
all right, we understand, and we are going to work to make this law or to change policy in a way that better
Right.
helps pregnant people.
I was at one of the meetings that where we had the roundtable that we've been working with locally. I was also intrigued as to how little doctors knew about the role of doulas,
Yes.
and wondering if there was any way, if we were to like build some bridges there, if they would be able to promote, help promote what it is that you do to help together get better health outcomes. Do you have any thoughts on that? I know I'm totally putting you on the spot right now.
No. So I really do, and I'm sorry about the light. I don't. It must be about to rain. It just like got
I
super
have
dark.
too
It's a
much
storm.
light. You have not
Okay,
enough. It'll
I'm
balance
trying to
out.
make it work, but so that is kind of one of the things that I see myself as doing. I genuinely believe that healthcare professionals in healthcare systems, doctors, midwives, IBCLCs, those people need to understand how important doulas are to perinatal health overall. And sometimes doctors, midwives, people in the hospital setting see us as, I don't want to say an enemy, because I hate to think that people feel that way, but we want to be a part of your patient's birth team. We don't want to get in your way. We're not saying that you're wrong. We are there to support the patient just like you are. So I think it's so important that healthcare professionals realize we just want to, work with you all. We're not trying to
Yeah.
usurp any authority, take anything away from the work that you do. And if healthcare professionals really took the time to educate themselves about doulas, spend some time with us. I think some hospitals have kind of figured out that, like, oh, if they're busy, nurses will always be like, oh, she's the doula. Okay, I can go
Right.
do X, Y, right?
Right.
Because you have somebody to bring the patient ice. You have somebody to wrap the blankets around them. So we're working in tandem. We don't want to
Right.
take away from anybody's role. But I genuinely believe if doctors, nurses, CNMs realize the power of doulas and how our constant, consistent relationship with the patient really helps the pregnancy experience, they would be overwhelmingly accepting of us.
So then that is a point where we can work, because policy can't do that, right?
Right.
That's something that we got to do as community.
Yes.
So we can work on that in the community. So, okay. Well, then why do you do this work? Like, why is it important to you personally?
So I do this work because I'm a problem solver. I don't have any children of my own yet, but I attended my first birth with a sorority sister in college. She didn't have any support.
Hold
And
up. What sorority?
hey, Soror!
Oh, hey, sorority.
Yes.
For real.
Yes.
Okay, we'll talk later. Okay.
Yes. So yeah, we're members of Alpha Kappa Alpha Sorority Incorporated, for those of you who are,
Incorporated.
okay. But yeah, so I was at her birth and I saw the experience and I just jumped in, and the nurse was like, you should be a doula. And I was like, what is that? So I started researching, I went to training, and since then I've just been supporting birth. To me, there's no way I can watch a woman carry a baby for 40 plus weeks and not make every effort to educate her, to support her, to make her feel at ease during that experience. In the postpartum experience, sis, you don't go take a shower, go take a nap. I'll
Right.
sit with the baby that doesn't want to be put
Wow.
down because they're used to being in
Yeah.
your uterus. Those are things that we do for one another as community. Calling it being a doula is really just a name, a title
A
that
name,
we're
right?
given,
That's
right?
that's community. That's
Right.
village. Like
Yes.
that's in our DNA.
Yes. So that is
Got
why
it.
I do the work. I know that's why so many of my doula sisters do the work. It's something that for generations we have done for one another. Now we're just giving it names and learning the educational aspects of pregnancy and learning about physiological birth. So
Okay.
yes, I
So
love
you
this work.
have, in 20 minutes, you have demystified an entire profession. And so hopefully we are going to share this and make sure that other people see it, because we want to continue to build on the work. We're going into special session,
Yes.
prioritizing what we were able to get for maternal health. If you weren't here at the beginning, this July right now, was the first official Maternal Health Awareness Month here in Virginia. There's a national one, Here in Virginia. So we've been having conversations that are specific to what we're doing in Virginia. We had a town hall roundtable. I don't know. I never know when to call it. We talked to a lot of experts.
Yes.
And if you go to my Facebook page and in my link tree, the link in my bio, you can connect to that, watch that, see some of the amazing resources. Like if you're pregnant right now and you think that you don't have enough money for the resources, there are so many resources that are free around Hampton Roads, and I did not know that. So they
Yes.
talk about all that. They talk about the importance of fighting for better policy and better funding. So it was a really good, it was like more than an hour. It was really good. And then we have this conversation. So I feel like this one has really been filled with awareness. And then we're going to work together, going into special session, save
Yes.
those gains that we made,
Yes.
and then 2021, we build more.
Yes.
So, what is your hope and goal for the next year for your profession?
In the Commonwealth, I would like to see some allocation in the budget for doula support. I think that that's going to make such a drastic difference in outcomes and experiences that there's no reason that it should be denied. Um, Among doulas, I really hope that, like you mentioned, the organizations, we come together, we're able to really strategize and organize together to build coalition of doulas all doing this work and really emphasizing the importance of policy to what we do. And I also think I would love to see the numbers of people who experience the support of a doula increase. Not,
Yes.
personally to make money, but because I know it makes a difference. And I want everybody to
Yeah.
have the best birth experience and outcomes that they want for themselves. So yeah,
And
I
there
think
it
we
is.
have.
That is the thing that ties us all together as part of, every single lane that we play. Delegate Aaron and I are just wanting better health outcomes for babies and pregnant people across the Commonwealth,
Yes.
specific to the 63rd and the 95th,
Yes.
because we were in those hot spots. But that's why we do what we do. And so, how can people connect with you should they have questions or want to? Maybe they're a doula and they want to join up.
So the easiest way is social media. I am Future Baby Catcher on Instagram, and on Facebook, I am. If you search Future Baby Catcher, it's me. And the reason for that name is because I'm in the process of becoming a midwife. So I serve as a doula now, but we'll be transitioning to midwifery in the future. So that way is best. And then you can go to Remedy Birth RVA here on Instagram. That is my business, or remedybirth.com. We have a lot of FAQs answered there. There's a contact point. There's tons of information about doula work and the work specifically that my partner and I do to support people, families, and communities.
Awesome. And if you're in the Hampton Roads area and you have any questions about what is available locally, you can shoot me a
Yes.
DM and I will connect you
Yes.
with any of the experts that we had on ours. So thank you so much, Courtney, for your time.
Thank you.
You all, thank you for watching. And now at least for Hampton Roads, we're going to go prepare for a potential hurricane
Yes, because
and
it's
really get about our
pouring
life.
here. So I know y'all are getting it.
Crazy. But thank you so much, Courtney. Have a good weekend. Take care, everybody. We will talk to you soon.
Thank you
Bye.
guys. Bye.